Yes, folks, New Zealanders are going through COVID-19 lockdown deja vu. Now, don't get me wrong, COVID-19 is real, but that is not the point. If Jacinda Ardern truly believed in what she is peddling, then she would take this virus seriously, but she isn't. The fact that she allowed the Black Lives Matter protest to go ahead means she is not serious. And the fact that she is not using hydroxychloroquine drug combos means she is not serious. And the fact that she is not using instant testing methods means she is not serious. And the fact that she is still making mistakes at the border and at quarantine facilities means she is not serious. Now, that lack of seriousness points to this lockdown being deliberate. And not only that, the fact that this lockdown is happening during an election period means it is deliberate. And the fact that Ardern postponed the Tonga travel bubble until December means it is deliberate. And the fact that she telegraphed the lockdown was coming means it is deliberate. Hell, even Jerry Brownlee doesn't buy it.
A group of leading infectious disease experts have renewed their plea for politicians to work together to stop the spread of COVID-19. It comes after Jerry Brownlee was accused of peddling a conspiracy theory when he described the timing of the Auckland outbreak as interesting. Diana Vesich reports.
Interesting. The word National's Jerry Brownlee used to describe the government's warning of another outbreak, promotion of masks, and Dr. Ashley Bloomfield taking a COVID test.
I think it was interesting, though, that there were clearly there was a higher degree of interest in making sure the COVID-19 prevention messages were out there.
Yeah, and he's absolutely correct there. Ardern telegraphed all of that.
Conspiracy, a word that's bombarded social media with various theories about who knew what and when. It's groups like this one in Whangarei protesting lockdown, causing concern that misinformation on COVID-19 is spreading.
The global situation is the evidence that this is very, very real. We need to take it seriously. And if you're someone that views politicians suspiciously, then please, by all means, listen to the independent doctors, scientists, those who are our source of advice that we lean on.
Our source, you've got to be kidding. Advice from the CCP-controlled World Health Organization. Anyway, in the next clip, Brownlee cowers to the left.
Conspiracy theories abound that the government's known about this outbreak longer.
Yeah, but at least Billy has got their attention now, and that is a good thing.
The Public Party, which calls COVID a plandemic, was pushing the cover-up conspiracy at a march in Whangarei today.
Yeah, and this is where Billy loses everyone. Here he is speaking in front of the separatist Maori flag.
National also questioning Jacinda Ardern and Ashley Bloomfield's COVID-related photo ops this week, yesterday calling the timing before the outbreak an interesting series of facts. Government ministers piling on.
That was irresponsible, and the claims are just ridiculous.
I was absolutely astonished that he would deviate with that sort of speculation and rumour mongering.
I do think it's worrying that a senior politician from one of our big mainstream parties has a propensity to kind of spread that sort of misinformation.
After the comments backfired magnificently, Jerry Brownlee's now claiming he was misrepresented.
I don't think there's anything conspiratorial in that at all. It was, in fact, highlighting some very important public health messages.
That was stupid. He just cowered to the groupthink mob.
Just that the government was trying to get out.
A group of more than 50 leading scientists and health professionals have penned a letter to all politicians urging them to put politics aside, resist the temptation to scaremonger and point score. Both sides are guilty of it. The government more than happy to pile onto the Nats, but on this one, the National Party with its borderline conspiracies is squarely in the wrong.
What gives you the right to make that judgment? You are just a reporter. Anyway, right now it's deja vu time. Now this is the past.
A woman who's just left managed isolation at Novotel Auckland Airport says the government is lying about the adequacy of its border testing regime. The woman who Checkpoint has agreed not to identify arrived home on June 4th. She says multiple people were allowed to leave the hotel without undergoing a single test for COVID-19. That's despite the Director General of Health claiming no one is leaving managed isolation without first returning a negative test. The woman told our reporter Nick Trubridge she was gobsmacked by the lax attitude of health authorities upon her return to New Zealand.
Well, when we landed, I actually was thinking there was going to be more to it, that as soon as we landed, besides having our temperature taken, we would be having a coronavirus test. Unfortunately, that wasn't the case. Which has annoyed me to beyond belief. I do feel that everyone that lands in New Zealand has a coronavirus test, because if you wait 3 days at the hotel, you are still around the public. So when you, the other quarantine people. So we were given the option, and it's an option, not mandatory, like I saw in the news the day I was leaving, which has a...
In Christchurch, he had to ask to be tested. If this is an effective isolation regime, it does seem to be leaving a lot to chance. Caden Wilson joins us now from Christchurch. Morning, Caden. So nice to have you with us, and welcome home. How are you?
Thank you. I'm good. How are you?
Yeah, good. Yeah, I'm good. Are you still in isolation? So you're in a hotel in Christchurch now?
Yeah, day 10.
Right. And you had to ask for a test. You hadn't had a test in Auckland when you were moved down?
No. So, because I found out the same time as everyone else in New Zealand found out that I was in the same hotel. So that morning I rung up and I was like, can I please have a test just for peace of mind? And originally they said, no, I'm required it on the 12th day. So then later on that afternoon, contact tracing called me and then said I needed a test immediately.
Hold on a sec. So you called, and did you say you were staying at the same hotel in Auckland as the two women who drove to Wellington who were positive? You told them that?
Yeah.
And you asked for a test and they said no. Then they called you, contact tracing called you and said you have to have a test?
Yes.
Right. Which speaks of the left hand not knowing what the right hand's doing, right?
Compulsory self-isolation came into force at the strike of one, but not for everyone.
I don't see the point. I know it's also illegal not to self-isolate, but who's going to catch me?
We asked another traveller.
I don't know, honestly. It depends if I get sick, obviously, yeah.
Big problems, it seems, in just the first few hours.
Another top Auckland hotel, another breakout.
Let's be very clear, this person did not have any authorisation to leave whatsoever. He broke the law in leaving the facility.
But this time, public health's at stake. This morning, the 32-year-old escapee tested positive for COVID-19. It was around 10 to 7 last night when authorities say the man fled through a fenced area at the Stamford Plaza while having a smoke.
There was contractual staff removing the fences and replacing them at the time, and was not clear whether or not this was a contractor or indeed the person who was in there for a period of smoking.
Security attempted to follow the man but couldn't find him. He made the 400 or so metre walk from the Stamford Plaza to the Central City supermarket.
The person visited the Countdown supermarket in the time they were away from the facility, including visiting a small number of aisles and using a self-checkout.
He returned to the hotel just over an hour later, police then ordering a thorough clean of Countdown's self-service checkouts. But authorities aren't saying if he went anywhere else. They're reviewing CCTV footage.
Once we have that footage confirmed, I'm sure there'll be more to be said on that.
When the man's test returned positive this morning, Countdown shut down, but not before potentially hundreds of shoppers passed through it. The supermarket.
Yeah, now this is the present. Now see if you can spot any changes. See if you can spot any improvements.
News Hub can reveal that just 1 week before our current community outbreak, 63.5% of all border and hotel isolation workers in Auckland had never been tested for COVID-19.
These are the workers who come into contact with people coming into the country with the virus. Investigations reporter Michael Mora has this exclusive report.
They are part of our most high-risk group. Airport staff, hotel workers like security, all working in the vicinity of recent returnees. Yet only a fraction had been tested prior to this outbreak.
It beggars belief that in an environment where the border is your major protection against a second wave of infection, that you're not exhausting every possible opportunity to mitigate risk.
The Health Ministry says as of August 3 last Monday, 1,089 border workers in Auckland had had a test. However, figures provided to News Hub show there are 40 Air New Zealand ground staff, 47 immigration staff, 52 biosecurity officers, 141 customs officers, and 2,700 managed isolation or quarantine staff. A total of 2,980 workers in Auckland. So, 63.5% of a workforce at risk just last week who had never had a test.
That is a problem. We need regular testing of the staff working at the borders and in these facilities who have contact with infected people arriving in New Zealand, because that is how future outbreaks and probably the most recent outbreak started.
I think the community deserves better than such a casual approach to surveillance of infectivity or possible infectivity amongst the border workforce.
The Prime Minister says all staff will now get a test.
We are working through testing all our border staff as we speak. We've given ourselves a period of time to make sure we get through that.
Previously, however, isolation hotel staff, for example, were only being offered a test every 2 to 3 weeks. Now, it'll be compulsory.
We are requiring staff at our borders to be tested in this round of testing.
I just about fell off my chair yesterday when I heard people say, well, we're going to test the whole workforce. I had obviously naively assumed that was already happening.
Yeah, and so did the rest of New Zealand. Nothing has changed. Anyway, now to a bit more deja vu. Now, this is the past.
Today is also day 75 of being in a COVID alert level of any kind. Our team of 5 million has both sacrificed and achieved a huge amount in just under 11 weeks as the world reckoned with and continues to reckon with a virus that went from obscurity at the start of the year to a global pandemic that will linger, with second waves a constant reality. As it spread rapidly around the world, we all saw people losing their loved ones and their livelihoods at a rate that was never acceptable to us. And so here in New Zealand, we went hard and early.
We went hard and we went early. She sounds like a leader in control, doesn't she?
With a single plan that had a dual purpose: to protect lives and to protect livelihoods. Self-isolation for all returning travellers came into place first, 17 days after our first case. We closed our borders to everyone but New Zealanders 20 days after our first case. Our first economic package, including the critically important wage subsidy scheme, was in place 19 days after the first case. Most other countries took more than 40. And then New Zealanders did something remarkable in our fight to beat COVID-19. We united in unprecedented ways to crush the virus. Our lockdown was in place 26 days after our first case, when we had just over 200 cases. Google tracking showed that during our lockdown, New Zealanders massively reduced their movements by 91% to retail and recreation, better than Australia, the UK, the United States, and nearly every other place we have compared ourselves to. Had we not acted, 11 days into our lockdown, we were projected to have 4,000 cases. We had 1,000, and one of the lowest rates per capita in the world. That was what the sacrifice of our team of 5 million was for.
Now this is the present.
The level 3 restrictions and the speed in which they were implemented will have made a material difference in containing the spread of this outbreak. So will everyone's compliance with those restrictions. Auckland travel data yesterday, the first full day of level 3, shows a 60% reduction in travel compared with the last 3 Thursdays, which is even less travel than at level 3 last time, which just demonstrates the incredible job that Aucklanders are currently doing. This is also what we know. We know the incubation period for COVID-19 and our experience of previous clusters, some of which reached more than 80 cases, means we can expect to see more cases as part of this cluster. It will grow before it slows, and it may continue to be linked to schools, churches and social gatherings as it has done to date. We also know, based on overseas experience and our own, that it is possible to contain a cluster or outbreak without ever being able to identify its origin. What is important is making sure that we establish the perimeter of the cluster and to stop it from growing. To do this, we do need to take into account that all-important incubation period. And so, in keeping with our precautionary approach and New Zealand's philosophy of going hard and going early.
Yeah, she is using exactly the same language. And that is my point, folks. She has got her stage back now, and that is exactly what she planned.
Today, Cabinet has agreed to maintain our current settings for an additional 12 days, bringing us to a full 2 weeks in total. Our current expectation is that by this time, the perimeter of the cluster will be identified, will be isolated, and we can move to level 2 in Auckland with confidence. That means Auckland will remain at level 3 and New Zealand will remain at level 2, the rest of the country, until 11:59 p.m. on Wednesday, the 26th of August.
Yes, without question, Ardern has hijacked this election. She is back on that stage, sucking the oxygen out of all competing parties. This is nothing less than a communist takeover of New Zealand, much the same as what is going on in America right now with the Marxist Black Lives Matter movement.